The muscles to the forearms are basically divided into 4 types: the hypothenar muscles, lumbrical, dorsal interosseous, and the palmar interosseous. Hypothenar muscles include flexor digiti minimi brevis, only at 5th digit, as I told you before how to count digit. Didn't I? Well, its origin is from hamate bone and insertion is from the palmar side of base of proximal phalanx of 5th digit. Then we have abductor digiti minimi, which originates from the pisiform bone and having insertion on 5th proximal phalanx and dorsal digit expansion of 5th digit. Abductor digiti minimi can cause flexion and abduction at the MCP joint of the little finger and extension at the PIP and DIP joints of the little finger. Then we have the flexor digiti minimi brevis, which can cause the flexion at the MCP joint of the little finger. Now the next set of muscles include lumbricals, in which we have the tendons of flexor digitorum profundus, which originates from radial side, which have the insertion on 2nd and 3rd digits, and tendons of flexors. And again, tendon of flexor digitorum profundus that originates from bipennate from medial and lateral sides having insertion on 4th and 5th digit. Tendons of flexor digitorum profundus can cause flexion at MCP joint and extension at proximal and distal interphalangeal joints. Moving on, we have the next muscle group, which is the dorsal interosseous. We have 4 sets of dorsal interosseous. The first originates from the 1st and 2nd metacarpal and inserts on the proximal phalanx. Then we have the second set, which arises from 2nd and 3rd metacarpal and inserts on the proximal phalanx of 3rd digit. Then we have the third set, which arises from the 3rd and 4th metacarpal and insert on the proximal phalanx of 3rd digit. Then we have the 4th set of dorsal interosseous, which arises from the 4th and 5th metacarpal and inserts on the proximal phalanx of 4th digit. The dorsal interosseous can cause flexion at MCP joint and extension and abduction on proximal and distal interphalangeal joint. Then we have the palmar interosseous. We have 3 sets of palmar interosseous. The first one arises from the 2nd metacarpal and inserts on the proximal phalanx of 2nd digit. The second one arises from the 4th metacarpal and inserts on the 4th digit. Then we have the last palmar interosseous, which arises from 5th metacarpal and insert on proximal phalanx of 5th digit. Palmar interosseous can cause flexion at MCP joint and extension and abduction at distal and proximal interphalangeal joint.